The presentation I'm going to talk about tonight is what are the implications of strike pattern injury. So there's been a lot of research and a lot of, people have been excited about barefoot running, a lot of people have been excited about changing strike patterns. So I'm going to try and break it down and just make it very simple in terms of what messages we can take to our patients and what we can use in terms of thinking about changing strike patterns to help with injury. Okay? So we'll try and keep it quite simple. Plenty of time for questions, etc. So if you've got questions, feel free to jump in. Likewise, at the end of the talk, same thing, and Andy will do the same as we go. So, what changes with forefoot strike? So this is a big thing that's come out of a lot of the barefoot. In my mind, I sit on the fence with barefoot running. I don't say that it's terrible. I don't say that it's fantastic. I sit on the fence, but I think for me, one of the biggest things that we've learned from barefoot running is that if we change our strike pattern, then we can possibly change injuries, both in terms of treatment, possibly prevention, but there's a lot we don't know. So in terms of what changes, we know that shifting the load will happen with forefoot strike. So we know that if we go from a rear foot strike to a forefoot strike, we're going to increase the load on the foot and ankle, we're going to decrease the load on the knee and hip. And I'll go into the research a little bit more in a second. We also know that it alters ground reaction force patterns, so it's going to change the way in which joint force is occurring, and it also alters muscle activity. So simply by telling someone to go from a rear foot to a forefoot strike will change a lot of things. So just going to give you a case example. This is one of my patients who I treated many months back. She came into me, she had some ITB issues, she had some anterior hip pain, she's a very heavy rear foot striker. So I had a look at this girl. This is not the only intervention we use, but one of the things that I looked at doing in the initial stages was, let's see what happens if we change her to a forefoot strike. Now instantly her pain improved dramatically. Okay, so pain was much, much better. Now interestingly enough, a couple of months ago she came back to me, doing really well, ITB is great, hip's great. She's got some medial tibial stress syndrome type symptoms. Nothing severe, but she's got some beginnings of that. So you're starting to think, okay, we need to think about this and what we're going to change. So what did I do with her on this occasion? We took her back to heel striking. No knee pain, no hip pain, no calf, no ankle pain. So point being that I think it's a horses for courses thing in terms of strike pattern. I'll go through that a little bit more now. So what do we know? So why did going to a forefoot strike pattern help her with her ITB symptoms? And help with her hip issues. We certainly know that in a rear foot strike pattern compared to a forefoot strike pattern, that our loading and the amount of shock absorption that we get is much, much greater at both the knee and the hip. So if we go from a rear foot to a forefoot strike pattern, we're going to reduce that loading at the knee and hip. However, if we go from a rear foot to a forefoot strike pattern, it also increases the load on our foot and ankle. So for this girl who's now got medial tibial stress syndrome, potentially that's one of the causes, is that we've now loaded up her foot and ankle. So it just simply shifted the load from her knee and hip down to her foot and ankle, and that's what's potentially causing an issue. So we take her back to a rear foot strike, and she improves again. So in very simplistic terms, a lot more complicated when it comes to employing gait retraining, running retraining, clinical practice. What else does strike pattern have an effect on? For those who aren't familiar with heel strike transient and loading rates, I'm just going to run you through this graph very briefly. So we know in terms of ground reaction force and vertical ground reaction forces, these are linked to injuries such as tailfemoral pain, plantar fasciitis and stress fractures. So with a rear foot strike, we have this peak which is called a heel strike transient. Okay? So it only occurs during heel strike, walking, heel strike, running. And what happens is you get this steep curve, and this is our loading rate. So between about 20% and 80%, it's the velocity of this increase in loading that we're getting. And this is what's being linked to things like plantar fasciitis and tibial stress fractures. So higher loading rates, steeper curves, more likely to be injured, or more likely to have injuries. We know from the research that if we change to a forefoot strike pattern, we actually abolish this heel strike transit, which has been linked to tailfemoral pain, and we reduce the steepness of this curve. So we have a big impact in terms of changing these loading rates, which hasn't been tested in terms of injury treatment or injury prevention, but certainly theoretically it makes sense based on the biomechanical knowledge that we do have. So in terms of kinematics, we know from some of the research that we will get greater knee flexion at landing if we change to a forefoot strike pattern. So a more compliant knee when we're landing, potentially that can have implications for tailfemoral pain, for patellar tendinopathy. We know that we'll get a reduction in rear foot eversion and tibial internal rotation in terms of peak. So we're getting less peak movement of these motions. But on the flip side, we actually get more range of motion. So there's more excursion, but less peak. So it's changing the movement patterns that are occurring. And the other thing which is really important to consider, and this is, I think, the girl who I've talked about initially, why she's possibly developed some of these issues, is that she's gone from a heel strike to a forefoot strike, and what's happened is this has increased her overstride. So the overstride being the distance from the centre of mass to the striking point of the ground. So if we look at that with a heel strike, she's overstriding already. If we change it to a forefoot strike, that overstride becomes much, much more, and that's going to load up the foot and ankle quite a lot. And that's a really important consideration if you're just changing their strike pattern, because you can certainly impact on that a lot, and possibly to the detriment of the patient. We also,
Christian, could you just explain that again? The increased overstride with the forefoot strike.
yeah. So if you've got the centre of mass here,
yeah,
we drop down, and then if we draw a line from there to where the rear foot is striking, so that distance there is, if you think about running economy and potential injuries, braking forces, that could be detrimental to the knee, detrimental to the hip. So we shifted that, but in this girl's case, what we've done now is we've actually made that distance, that overstride, much greater, because what we've done is we've changed from a rear foot strike to a forefoot strike.
So it's not necessarily increased hip flexion, it's just...
No, it's not the hip flexion, it's about the landing point. Exactly right. So that's what's really important. So we haven't actually changed what's going on the hip, we've just changed the strike pattern. And that's a really important consideration in terms of what we should and what we did do with this girl going forward. So in terms of shank muscle activity, we know that it will, from going from rear foot to forefoot strike, that it's going to reduce the amount of tibial anterior muscle activity. And that's pretty obvious because you're not going to get that same foot slap that you get when you're running with a heel strike. But at the same time, we're going to increase the amount of muscle activity through gastrocs, legs, and potentially this girl too close, which is where she's getting some of her issues. So in terms of, I guess if we go to the literature in terms of running, retraining and changing strike patterns, there's not a lot of literature out there. There's no great RCTs that shows that this is a great and effective method, but there are a couple of case series studies. So if we look at the patellofemoral pain, when I say case series, this is one with just 3 individuals, so it's not a big case series, but 3 individuals with patellofemoral pain, rear foot strikers, and what they did is they used some landing pattern retraining. What they did is they put a sensor on their foot. Every time the heel hit the ground, the buzzer went off. So nice and simple, it encouraged them to go to a forefoot strike. What they found with these individuals, using 8 sessions over a couple of weeks, is that they got a successful change in strike pattern. So the buzzer worked, that's great, but it doesn't mean it necessarily helps with injury. But this vertical impact peak and loading rate I talked about actually reduced also in these 3 individuals, and most importantly, their symptoms reduced. So purely just changing their strike pattern had a big impact on these individuals with patellofemoral pain. And Andy's going to talk more about the myths behind exertional compartment syndrome. I'm sure he's written a really nice paper on this, so I won't get into a debate about whether it's compartment syndrome or biomechanical overload. I'm sure Andy will touch on that when he talks. But the point being, this is what it's referred to in the paper. So this paper was in military recruits, and what they did is they got 10 individuals with what they termed as chronic exertional compartment syndrome, and they did 6 weeks of forefoot strike retraining. They did a lot of other interventions in terms of foot and ankle strengthening, which is important. We won't go too much into that tonight, but they did 6 weeks of forefoot strike retraining, and they successfully changed the strike pattern from a rear foot to forefoot strike. And this reduced anterior compartment pressures during run, and also reduced the amount of pain during running. Most importantly as well, for these individuals, it increased their 2-mile running time. So it wasn't just a reduction in pain, but also improved their performance. So going from a rear foot to forefoot strike. So I'll wrap up there, and I'll throw it open to questions before Andy comes on and has this chat. I'll just point out this is our clinic website. If you're interested in tendinopathy, Pete has a fantastic blog on there. Likewise, we've just set up a biomechanics blog as well, so if you're interested in biomechanics stuff, there's going to be a lot more stuff around what we talked about tonight. And there's also a patellofemoral pain, those who are interested in patellofemoral pain, like my obsession. And if you're not on Twitter, get on Twitter. It's pretty fun.